Welcome to today's episode of The Untold, where tonight we're going to uncover a more clinical side and medical side of things. I'm your host, Alqallaf.
And of course, I'm your host, Abdullah Al-Hindiani. And Lujane, today we have dentist Dr. Mashael Alqallaf, who is in dentistry. And for a lot of people, even myself included, because I've had a lot of dental work recently made, dentists are, for some reason, I am afraid of them more than doctors, right? Even though they are working to give us better smiles, right? But the idea, I think because teeth are so close to the brain, for me, it feels so scary, right? So today's episode is maybe a horror story for me. But with that being said, I am very excited to sit down, Dr. Mashael, to talk about dentistry, talk about her journey, her story so far.
I think that's actually a big fear for a lot of people, not just you. I never even thought of it being close to the heart. I think it's something to do with someone kind of getting into your mouth and doing things that you don't understand. So I'm curious to see the behind the scenes of it. And also people forget that dentistry is kind of like being a doctor. It's a very long field to study, to practice, and you're working with the human body. So I'm curious to see what Dr. Mashael has to say to us today about how she chose this field and, how it's going for her.
It is, and hopefully we can answer those questions after the break.
And we're back with Dr. Mashael. Dr. Mashael, welcome to the show.
Thank you so much.
It's a pleasure to have you.
Pleasure is mine.
It's so cool to hear that you're a dentist. I wanted to ask you, why did you choose a career in dentistry?
Well, actually, when I took that decision, I was fairly young. And at that time, as being a young girl, I had hobbies like reading and drawing. So I was looking for a career to use my dexterities and to have fun, also to enjoy it and to serve the community. To be honest, I can't see myself doing something else other than dentistry.
MashaAllah, it's always great to know that, you've chosen something you're passionate about and now you feel happy about it.
Right.
But, going back before going into dentistry and studying it, what was your perspective on the field itself and how did it change after studying it?
Well, at that time, I never thought that would be that hard. But after, let's say, when I blended in dentistry, I realized that I have to study hard, start to study science hard, and then use my dexterities to improve the drawing talents that I had. And then there you go.
I mean, it's so unique for me to hear someone going from drawing and, as you said, using your dexterities in your fingers and the detail that requires and translating it to a science like dentistry.
Right.
I think a lot of people won't make that connection. So it's really cool that you're able to take something creative and turn it into this field, which you now can't imagine doing anything else.
Yes.
What would you say was the most challenging part of, your training?
The studying, or let's say the hard work that studying dentistry was needed, that wasn't the hard part. The hard part was being away from home, family, and friends. Because I did my undergraduate in Dublin at Trinity College, and then did my postgraduate degrees at University of Maryland, and then later on at Boston University in the States. And the total was around about 11 years away from home.
MashaAllah.
Oh, mashallah, that is a long time.
Yes.
That's the thing about studying medicine or dentistry. It's not a career for the weak in that sense, because you do have to train and study for so long because you're working with the human body.
Correct.
So it's different than me. I studied English literature. I needed maybe 4 to 5 years tops to complete that with my master's. But because I'm not working with actual people, it's a completely different ballpark.
It is, honestly. And the first time you got there, because you said that the anxiety of being away from home was so, extreme. How did you feel with homesickness? How did you feel with missing home? How did you feel, of fighting that feeling of wanting to go back?
Well, it wasn't easy, and every year was harder than the year before. But I've adjusted because I was, dreaming of being a dentist. So I worked hard for the whole period of studying and, to finish all the degrees.
And what would
Come
you
back.
and what would you say that all of that living abroad and being alone, as well as focusing on your studies, taught you about yourself as a person?
It built up my personality. I became more confident. I became more social with people because we have to communicate with the patients all the time. Let's say for my job, I don't socialize outside the clinic, so our socialization is mostly with the patients.
I can imagine it being a very hands-on kind of job.
Yes.
It is. And speaking about socializing with the patients, a lot of people for some reason are afraid of dentists even more than regular doctors. Even though, dentists are always the ones who cheer you up, talk to you, give you the gas that makes you laugh. So dentists are our friends within the medical field, but a lot of people do have that anxiety. So how do you feel, or how do you communicate and talk to a lot of these people who fear dentists, who have anxieties?
Well, yes, there are so many people who often, fear the dentist, and that is the challenging part. We do see anxious patients often at the clinic, but we are trained to handle that situation. But again, this depends on the dentist's personality. This is where it makes a difference. They can use their own way to reach their patients and make them comfortable.
Well, normally an appointment doesn't last that long when you're meeting a patient. So how can you build trust in such a short amount of time?
The key factor in gaining trust of the patient is to listen to them and treat them with passion, and also provide them with assurance. This is the most important part. But also, this is a double-sided gun, because if you lose that trust, then it's going to be very hard to regain that trust again.
I can imagine.
So we have to be calm and confident by conveying these feelings to the patient.
And how would you, gain a patient's trust? Is it by talking them through the procedures from A to Z, or what is the process like?
Of course, you have to be friendly with the patient and talk over and explain everything's going to be done as the treatment plan. And, an appointment, after an appointment, they're going to get used to you and trust you, especially if you are, nice to them, talk to them all the time, make them laugh. So they were going to trust you.
That does make sense. I think I've encountered a lot of dentists who are actually very funny. I feel like a lot of them are very good at making jokes or trying to make you comfortable in that sense, because I think a lot of people, the fear comes from you have to lay down and have your mouth open and you can't move or talk or do anything.
Right.
So to have someone who's always just kind of talking in a comfortable manner, in a calm way, it's very reassuring. Whereas if someone was just being very clinical about it and not explaining what they're doing, you would be more afraid, because I think a lot of people, we build up stuff in our brain more than what the actual thing is.
Right.
Like when you have the idea of what is happening, you're so much more relaxed than when you have no idea what's happening.
Yes.
You just have your mouth open, you don't know what's going on. But when they're like, right now I'm going to do this, and right now I'm going to do this, and they'll make a joke, or sometimes they'll allow, especially when you're young, for your mother to be there with you, or your father or something. So I think it really helps to have this kind of relationship, as you mentioned.
Yes.
Do you find it easier or harder to work with younger or older patients?
Regarding my specialty in my field as an endodontist, I usually see patients, let's say the adult patients, not the younger patients. But I don't mind seeing them because they're going to feel comfortable as well.
What did you say your specialty was?
Endodontics. I'm an endodontist.
Oh, what is that?
That's a specialist of root canal treatment.
Oh, that sounds pretty scary.
I think that's why a lot of people are afraid of dentists, right? But speaking of which, there's a fine degree that separates, I would say, within the medical field between being a good doctor, a good dentist, and being a great doctor and a great dentist. So what we say is that, little margin of difference is that takes someone from being good to great.
Well, it depends who's asking about a great dentist. If it's the patient, then a great dentist is the one who doesn't make them feel pain, treats them well in terms of respecting their time, and treats them with passion. But in reality, the great doctor is the one who has great talent, and they master the science behind what they're doing. So all of that will lead to proper treatment, and the treatment that will last for a long time.
No, that makes sense, because I think sometimes, especially in the world of medicine, dentistry can be quite overlooked, because people forget that, well, we need our teeth in our mouth and our gums for everyday life. From when you're a kid to all the way when you're older, this is something that we use to eat, to speak. There's no getting around it. And it's also what people can see when they look at you straight away, when you smile.
Yes.
So it's a very important part of everyone's lives. And I do want to ask you, because I know some people only view dentistry as a science, but would you say it's also an art? Or is it a mix of both, or is it strictly just science?
Well, it's a mix of both. To be honest, everything we do, it's we have something actually in dentistry and medicine called evidence-based
What is that?
practice. So usually when they treat the patients, we go by the book.
Okay.
But we have this evidence-based practice. This is where anything we do inside the mouth should be clinically proven outside the patient's mouth first.
Interesting.
Right? And then between the black and white, there's always a grayish area that every dentist should be able to add their own, touch to it.
And honestly, I think if you have a certain, I'd say, dentist that you frequently go to, you can always find that, unique touch, right? So sometimes,
Exactly.
yeah, sometimes your dentists have a day off and then they tell you, oh, go to this doctor, he's a friend of mine. And then you go to the other dentist, he's like, okay, no, I'm gonna wait for my dentist because it feels, his touch is unique, his interaction is unique. There's a feeling of camaraderie between a patient and a dentist or a doctor that you frequently visit, right? And there's a feeling of safety there. With that being said, we are going to take a very quick break, but we'll come right back after the break.
And we're back from that short break. So Dr. Mashael, I wanted to ask you, what is the most physically demanding part of your job?
Physical, you know that we are working all the time. We have to keep a certain posture when we are sitting on the dental stools.
I didn't think of that.
Yes, this is very important.
And what about the mental side?
The mental side is the most important. The physical part is not difficult. It's the easiest part. But the mental part is more important because we deal with patients of different personalities. So we deal with them differently. And we have to keep like a certain strategy for engagement with the patients all the time, so we can have a fruitful, treatment for the patient.
No, that does make sense. I think a lot of people overlook the more mental and social aspect of dentistry because you are dealing with people all the time as well. You're putting in long hours, you're doing technical things, you're working on, the teeth and all the stuff that you have to do, which already takes a lot of energy and effort. But then you have to talk to people all day, and it's multiple patients in one day, and it's hours of that. So, mashallah alayk, that you can, handle all of this.
Actually, working is not hard. The talking part is more,
I think dentists should have someone who takes charge of the talking, and then whenever the procedure is going and the patient is under full anesthetic, that's when the dentist come in, just finish the job and go and be like, okay, operation done. With that being said, I do want to ask you about something, because you mentioned, having that safety net with the patient. So in a lot of high pressure situations, a lot of very important operations, how do you manage to stay calm and, suppress those nerves and to continue on, as normal?
I have to stay calm, because if I don't stay calm, I will lose control. So this is not an option to me. I have to be calm to go on with the procedure.
Yeah, no, fair enough. It's not, as you said, you don't have another choice. You have to stay calm because you have to keep the patient calm, and you also have to focus on what you're doing. So it's just not an option. It's not something I would have thought of. Because I think when me and Abdullah are having a bad day, it's like, oh, we're having a bad day. But for you, they're like, even if I'm having a bad day, there is no choice. I have to focus, I have to stay calm. So I think that just adds to, I think, one of the many skills of dentists that people don't know about, you know?
Yes.
So how do you handle, you know, difficult outcomes or mistakes that might be made, or telling people about bad things that they have to deal with or do?
Now, if there was a mistake in the administration part, I mean, a problem with reception, a problem with the appointments, that's very easy to solve in, you know, in a common sense. But the problem is if we have, you know, something wrong or a mistake with a treatment outcome. This is the problem. So, you know, we can make mistakes all the time. I mean, but going back to your question about the great dentist, here where it makes a difference. So how they encounter the mistakes, is it once every 100 to 200 cases, or is it once every 2 to 3 cases? Here, this is the difference between the good and the great dentist. Going back now to how we handle or solve the mistakes, we have to be honest with the patient. We have to explain what is going on and try to solve the problem. So if that's not possible, then you have to refer the patient to more experienced specialists. So in my field as an endodontist, I receive too many referrals from good, caring general practitioners. Sometimes they have a problem with the patients when treating. Sometimes they break like files inside the roots. So they refer them to me so I can help and remove that fractured file from the root. Yeah, that's basically what's going on.
Yeah, that doesn't...
And
yeah.
We as specialists, we are supposed to solve the problems, not to create one.
Oh yeah, 100%. But you know, there is human error sometimes, and I think sometimes maybe a patient isn't honest with you about what the problem is. That can be a thing. I know I had an experience as a teenager. I actually wore braces twice, and it's because the first time after I wore it, I didn't wear the retainer properly after.
Okay.
So the teeth kind of moved back to some positions.
That will happen.
Yeah, but as a young teenager, it was just very annoying to wear all the time. So after a bit, I'm like, I don't need to wear this anymore. And then my teeth moved and I had to wear the braces again. So that was my lesson, to always listen to my dentist and my doctor when they tell me, because I think people forget about how even it's not just the treatment, but the aftercare as well. That's a big deal in terms of making sure things follow what you guys know is the correct path.
Yes.
Yeah.
Yeah, I think you can never go wrong with following the advice of always listen to your doctor. Right? You can never go wrong with that. I do want to go back on some point you did mention before, is that you sometimes, or a lot of times, you get referrals. So when you're dealing with a referral patient, is it a lot trickier than dealing with a patient, you know, of your own patient? Because now you have to see, or you have to follow the path of where the mistake happened, going all the way to step one that the other maybe dentist made. So I feel like it's a lot trickier because it's like you're remapping something that is already there.
Well, you know, I will be very happy if I receive these kind of patients, because it's challenging to me, and I will be very happy to help and treat the patients with complications.
Yeah.
So do you enjoy?
Because this is my job as a
enjoy?
specialist to do that. Of course.
You enjoy the more challenging.
Of course.
I feel like that's refreshing to hear. I think the people like you like the puzzle to solve sometimes.
Yes, I like complicated cases, and that's what I'm focusing right now on, these kind of cases.
MashaAllah. So what would you say is the most rewarding part about your, you know, industry and field as a whole?
Well, your question is a subjective one, but to me, I feel very happy and satisfied when I treat the patients and try to, you know, satisfy their needs. I feel very happy to do that. I put everything together so to do the successful treatment, and also as I told you before, it's challenging to me to treat the patients. So inside of me, it's like a successful goal that I want to reach.
I mean, I think that's really wonderful that you have that feeling and, able to maintain that. And going back to what you said about enjoying the challenging cases, I think it's great that there are dentists like you who actually want the challenging cases, the cases that are harder and tougher to solve. How do you feel when you've managed to kind of fix a problem like this for somebody?
How do I feel?
Yeah.
I feel great. I feel happy. I feel that I'm satisfied, that I helped someone. They will leave the office also very happy and comfortable. And
Yeah.
of course, I know that they're gonna come back to me.
Yeah, and they're going to tell their friends
Yes.
also, especially if it's a complicated case.
Yes.
It is. And speaking of telling friends, like what would you tell, other people about who, especially, I'd say young people, students who are thinking about pursuing dentistry, thinking about chasing this kind of career path?
Well, any career that involves humans, such as like medicine, dentistry, or nursing, I advise them that they have to be committed, and they have to study really hard. They have to put everything, like effort, time, energy into it. So I advise them that they study or take it seriously and study really hard and do some sacrifices.
Yeah, I think that's fair enough. I think a lot of people, when they look at medicine or dentistry, they think about, the more studious parts, the parts where you have to work hard and study hard, and it's going to take time and effort and all of that. But as you said, they forget that it's actually also a very social thing, because you're dealing with patients, you're dealing with people, and you have to always be positive and calm around those people. So it's a really good piece of advice, I think, to share with people, that to focus on both sides. Be aware that you will have to deal with people, but also focus on your studies, and it will be rewarding as well. I think that's really great advice.
Yes.
And to wrap things up, I do want to ask you one final question,
Sure.
which is, what do you see for yourself in the future when it comes to dentistry? Where are you going?
Where I'm going, I'm always updating myself with the latest, procedures, latest, let's say, equipments. And also I'm looking forward to have my own clinic as well in the future.
That's amazing, and I really hope you get one as well,
I hope
because
so.
especially someone who likes to focus on complicated cases, I think you deserve one. So
Thank you.
I want to thank you so much for joining us today and sharing the, behind the scenes of dentistry, because a lot of us don't really know about this that much, so it's helpful to learn.
Yeah, honestly, it was really great and very enlightening, especially about the ins and out of dentistry. So we do want to thank you, Dr. Mashael, for joining us here on The Untold.
Thank you for having me.
Thank
It's
you.
been a pleasure. And with that, we are going to take a very quick break. And we're back from that short break. And honestly, Abdullah, talking to Dr. Mashael really opened my eyes to the behind the scenes of dentistry. I mean, I always knew that it took a long time to study, but I didn't realize, how deep the studying could go, and how actually in the everyday practice, there's a lot more socializing involved than people think.
It is, honestly, I think for a lot of doctors, I would say, social aspect of their career is something they find challenging, right? Because every day, if you're seeing 20 people, that's 20 different personalities, and you have to adjust your personality based on all of them. Even if they all have the same case when it comes to the medical side of things, their personality, the way you approach them, the way you talk to them is different. And I think she highlighted that, how talking to people, communicating with people is a very integral part of the job that requires a lot of attention.
Yes, and the way that she also mentioned how important it is to stay calm and build trust with the patient, I think that really helps alleviate any fears the patient may have, and also allow for the best sort of success to come out of the procedure.
It is, honestly, she was very assuring in her talk, and we do want to thank her again for joining us. We also want to thank the viewers for tuning in. With that being said, I think that's it from us. It's a wrapping conversation from here of The Untold. Until next episode, goodbye for now.
Goodbye, and see you next time.